Raynaud's disease is a vascular condition that causes color changes, pain, and numbness in the fingers and toes. It is triggered by cold temperatures or stress. This video will cover various aspects of the disease to provide a comprehensive understanding for medical students and professionals. Raynaud's disease involves abnormal blood vessel reactivity and communication between nerves and blood vessels. This results in excessive narrowing of blood vessels in response to cold or stress, reducing blood flow to the affected fingers or toes. Dysfunction of the cells lining blood vessels, including reduced production of nitric oxide, increased levels of vasoconstrictive substances, and increased platelet activation, is a crucial factor. Nerve signaling issues, particularly involving the sympathetic nervous system and sensory nerves, also contribute to blood vessel spasms. There are different types of Raynaud's disease. Primary Raynaud's has no underlying disease and is more common in young women. Secondary Raynaud's is associated with other conditions like connective tissue disorders or certain medications. Occupational Raynaud's is caused by occupational factors, mainly vibrations. Raynaud's disease affects 5 to 10% of the population, primarily women. It typically starts between ages 15 to 30 but can occur at any age. Certain factors, like smoking and cold exposure, increase the risk of developing Raynaud's disease. Raynaud's disease presents with 3 phases: pallor, cyanosis, and hyperemia. Symptoms include numbness, pain, and tingling in affected digits. Rewarming offers temporary relief. Severe cases may have ulcers, gangrene, and spontaneous healing after attacks. Early recognition is key for proper diagnosis and management. The diagnostic evaluation of Raynaud's disease involves a comprehensive assessment to confirm the diagnosis and exclude other conditions with similar symptoms. Nail fold capillaroscopy is a non-invasive procedure that allows visualization of the microvascular abnormalities in the nail fold beds of the fingers. This technique aids in differentiating primary Raynaud's from secondary forms and provides insights into disease severity and prognosis. Digital thermal imaging, also known as thermography, can detect temperature changes in the affected digits and further support the diagnosis of Raynaud's disease. Distinguishing Raynaud's disease from other conditions presenting with similar symptoms is crucial for accurate management. Differential diagnoses include acrocyanosis, frostbite, peripheral arterial disease, vasculitis, and cold agglutinin disease. These conditions may share some clinical features with Raynaud's disease but have distinct underlying pathologies and management approaches. Employing appropriate diagnostic criteria, comprehensive history taking, physical examination, and interpreting relevant investigative findings can aid in making an accurate diagnosis and guiding treatment decisions. The treatment of Raynaud's disease involves lifestyle changes, such as avoiding cold exposure and stress reduction. Physical and occupational therapy can be helpful for occupational Raynaud's disease. Medications like nifedipine, prazosin, and iloprost are used to relax blood vessels and improve blood flow. Raynaud's disease can lead to various complications, emphasizing the importance of early diagnosis and appropriate management. Prolonged vasoconstriction episodes can cause tissue damage, resulting in the formation of digital ulcers or even gangrene. Additionally, the healing process after such complications can be challenging, necessitating advanced wound care and potential surgical interventions. Therefore, regular assessment of the affected digits and close monitoring of any signs of deteriorating perfusion are crucial in preventing these complications and optimizing patient outcomes. The association between Raynaud's phenomenon and rheumatic diseases, such as systemic sclerosis, lupus, and mixed connective tissue disease, is well established. Raynaud's phenomenon often precedes the development of these conditions and can serve as an early clinical manifestation. In rheumatic diseases, the severity and frequency of Raynaud's attacks can correlate with the overall disease activity. Understanding these connections is essential for the holistic management of patients with rheumatic diseases and ensuring prompt intervention to prevent further complications. Cold exposure plays a significant role in triggering severe Raynaud's attacks, particularly in individuals with heightened susceptibility. Cold-induced attacks can lead to prolonged digital ischemia and exacerbate symptoms. Preventive measures, such as keeping the extremities warm with appropriate clothing, using heat packs or gloves, and avoiding sudden temperature changes, are crucial in minimizing the frequency and severity of attacks. Educating patients about these preventive strategies is essential for empowering them to manage their condition and improve their quality of life. The complex interplay between the sympathetic nervous system, vascular abnormalities, and blood flow regulation underlies the pathophysiology of Raynaud's disease. Dysregulation of sympathetic nerve activity, characterized by increased vasoconstrictor tone and abnormal neurotransmitter signaling, contributes to the excessive digital vasospasm observed in Raynaud's disease. Additionally, abnormalities in the vascular structure, including smooth muscle hyperreactivity and endothelial dysfunction, further compromise blood flow regulation in the affected digits. Understanding these intricate mechanisms is essential for developing targeted therapies and exploiting potential therapeutic targets. Certain occupations that involve working with vibrating tools can increase the risk of developing Raynaud's disease. Taking preventive measures like reducing vibration exposure, wearing protective equipment, and taking regular breaks can help minimize the severity and occurrence of Raynaud's episodes in occupational settings. Raising awareness among workers, employers, and occupational health professionals is important for maintaining a safe work environment and preventing Raynaud's disease in these settings. In conclusion, Raynaud's disease is a multifaceted condition that necessitates a thorough understanding of its underlying mechanisms, clinical manifestations, diagnostic measures, therapeutic interventions, and potential complications. Appreciating its links to rheumatic disorders and occupational hazards is crucial for optimal management and prevention. This video strives to equip medical students and healthcare providers with an extensive understanding to facilitate accurate diagnoses, implementation of suitable treatment strategies, and enhanced patient care.